everyone, I am Nikki Titi Hadillo from Section 11D, Group 16, and for today's video, I am going to perform the assessment of the thorax and lungs. Okay, so first we have to review the client's previous medical records because medical records explain all the details about the history of the patient, including the clinical findings, the diagnostic results, the progress, and the medications. So next we have to prepare the necessary equipment, especially our marker, our ruler, and our stethoscope. So preparing all of this will facilitate accurate skill performance. So next we have to perform the hand washing to prevent the spread of microorganisms. Okay, hello, good morning.
Good morning, Dito.
Okay, so I am Nikki Titi Hadillo and I am your student nurse for today. So may I ask your name, please?
Jan Andrade,
Okay, Gerald, how old are you?
14,
14. So when is your birthday?
April 7, 2007.
Okay, April 7. Sige. So what do you want me to call you?
Gerald.
Okay, Gerald, so for today's assessment, I am going to assess your thorax and lungs. So I am going to do an inspection, palpation, percussion, and auscultation to the part of your chest and at your back. And then I might ask you to sit down, to stand up, and then to lay down later. And I am going to touch the part of your body. So is it okay to you, Gerald?
Yes.
Okay. So before we proceed, would you mind if I'm going to close the door and the curtain so that no one will disturb you during the assessment?
No problem.
Okay. So now before we start the assessment, so I am going to ask you some questions about your health history. So do you have difficulty in breathing?
No.
Do you have chest pain right now?
No.
Okay, do you have cough or ubo?
No.
Okay, in the past health history, have you been to thoracic surgery?
No.
Do you have allergies?
No.
Okay. Do you have you been in a test in X-ray before?
No.
Do you have pneumonia before?
No.
Okay. In the family history is there in your family member have the history of lung disease?
Wala po.
Okay. Does one of your family use tobacco products or cigarettes?
Yes. My brother and my dad.
Okay. How about you? Are you smoking?
No.
Okay. So thank you for answering my questions, Gerald. So I'll rest assured that the documentation will be kept confidential between me, you, and the attending physician that will be referring to you. Okay. So do you have any questions or any concerns?
No.
Okay. Now let's proceed to the assessment. The first assessment would be surveying the chest and respiration. First, we have to check for signs of respiratory distress or any problems with oxygenation. So we have to observe the color of the face, the lips, the chest, and then the fingernails to determine if there is any signs of cyanosis. Okay, can I see your face, Gerald? So can I check your fingernails and then your chest? So next, we have to palpate the suprasternal notch and note the position of the trachea to determine if it is in the midline and it is symmetrical. The next assessment would be the examining the posterior thorax and lungs. So first, we have to inspect the configuration. So chest configuration is the overall structure of the the chest. So Gerald, can you take off your shirt? Okay, can you stand up? And then face here. So put your arms at the side. So while the client stands, so with arms at the side, so we have to stand behind the client and then observe the scapulae, the shape and the configuration of the chest wall. Okay, next we have to inspect the spinal alignment for deformities to determine if there is abnormal curvature of the spine. Okay, so Adral, can you face over there? Okay, so from a lateral position, so we have to observe the normal curvature, so which are the cervical, the thoracic, and then the lumbar. Okay, and then to assess for lateral deviation of the spine, so we have to bend. Okay, Gerald, can you bend? Okay, to observe the lateral deviation of the spine or scoliosis. So next, we have to palpate the posterior thorax. Okay, can you sit down? So face at the So we have to palpate the posterior thorax to assess the temperature and integrity of the all chest skin, and then palpate if there is a signs of bulges, tenderness, or abnormal movements. So using our dorsal part of the hand, so we have to palpate for the temperature. Okay, and then palpate for any bulges. So next, we have to palpate the posterior thorax for respiratory excursion or thoracic expansion, because respiratory excursion is the movement of the diaphragm or the thoracic diaphragm. Okay, using our palms with our fingers in stretch like this. So Gerald, can you take a deep breath using your mouth? Inhale, exhale, inhale, exhale. Again, inhale and exhale. Okay. Next, palpate the thorax for vocal tactile fermitus. So it is a faintly perceptible vibration felt through the chest wall while the client speaks, to assess for increase or decrease of lungs density. So using our ulnar surface of our hands by palpating the thorax, and then ask the client to say 1, 2, 3, and then with this 2-step we have to repeat this with moving our hands sequentially. So and then compare the fermitus of both lungs and between the apex and the base of the lungs. So Gerald, can you say 1, 2, 3 when you feel the ulnar surface of my hand?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, so now we have to percuss the posterior thorax to assess for lungs resonance. So we have to ask the clients to bend his head, so like this, and then we have to fold the arms forward across the chest like this, and we are going to percuss the intercostal spaces at about 2 inches intervals, and also we have to follow the systematic ladder patterns, and then we're going to compare the findings at each point to the opposite side of the chest wall. So sir, Gerald, so can you do like this, cross arms, like that, and then bend your head. Okay. have to measure the diaphragmatic excursion to measure the movement of the diaphragm during the maximal inspiration and expiration. So we have to do the percussion to identify the level of the diaphragm. And then we are going to mark the level of the expiration. And then we had to ask the patient or the client to inhale deeply and hold it so that we can percuss. So we have to repeat this to the other side to measure the distance between the expiratory and inspiratory levels of dullness. Okay, so using our ruler to measure and then our marker or washable marker to mark the measurement. Okay, Gerald, is it okay to you if I'm going to use a marker to your at the back?
Yes.
Okay. So Gerald, can you inhale and then hold it for at least 3 seconds and then exhale?
Okay.
And then exhale. Again. Okay, to the other side. Inhale and then exhale. Auscultate the breath sounds to assess the airflow through the airways. So we have to place the diaphragm of the stethoscope here to the chest wall, and we have to ask the client to breathe deeply using his mouth, and we have to auscultate using the ladder pattern, and we have to compare this the findings to the opposite side of the chest wall. Okay, Gerald, can you take a deep breath when you ever feel the stethoscope, okay? Okay, now that we are done auscultating the breath sound, so now let's proceed in auscultating the voice sound. So using the flat disc diaphragm of the stethoscope, so we can differentiate the sounds that has the same pitch and loudness. So first, we have to do the bronchophony method, so which the patient can say 99, and egophony to repeat the letter E, and whisper pectoriloquy to say 1, 2, 3. Okay, Gerald, can you say 99 if you could feel this diaphragm, okay?
99, 99, 99, 99, 99, 99, 99.
So now, can you say letter E, or can you like this, E, E, okay?
E, 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 E,
Okay. So now, can you say 1, 2, 3? Can you repeat it?
1, 2, 3.
Okay.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. Now that we are done assessing the posterior thorax, so let's proceed to the anterior. So first we have to inspect the breathing patterns. So it's a various respiratory patterns have localizing significance in the patient with altered consciousness. So remember, the normal breathing pattern is at 12 to 20 cycles per minute. Okay, Gerald, can you lay down first here? Okay, can you here? Just relax, Gerald. So next, inspect for the costal angle to evaluate the expansion of the thoracic cage. Okay, now we have to palpate the anterior thorax for the tenderness, the sensation, the surface masses, and then the crepitus, fremitus, and etc. So we have to use our fingers to palpate the tenderness and the sensation in the chest wall. And we have to palpate over the left clavicle over systematically, okay? So next, palpate the anterior thorax for the respiratory excursion or chest expansion. Because respiratory excursion is the movement of the thoracic diaphragm. Okay, so we have to place our hands like this with the fingers laterally to the rib cage and the thumb to the costal margin. So we have to ask the client to take a deep breath while we are observing the movement of the hands. Okay. Okay, Gerald, can you inhale, exhale using your mouth? Okay. So, next, we have to percuss the anterior thorax systematically to assess the lungs for resonance. Okay? So, we have to begin the percussing above the clavicles and we have to proceed downward here to the diaphragm. And we have to compare the lung at one side to the other side. Okay, now, so we have to auscultate for the anterior breath sounds, the adventitious breath sounds, and also the voice sounds. So that when we are auscultating, so it can differentiate the two sounds that have same pitch and same loudness. And also, it will assess the air flows through the airways. And then we have to auscultate the trachea to differentiate the respiratory sound. So next, we have to auscultate for the anterior thorax. So what we're going to do, we have to place the diaphragm of the stethoscope here in the chest wall. And then we have to auscultate from the apeces of the lungs slightly to the clavicle of the basis of the lungs. So we have also to ask the client to breathe deeply through the mouth. Also, we have to listen each side for at least one complete respiratory cycle. So you see the ladder pattern. Okay, Gerald, just breathe deeply through your mouth, okay? Okay. Okay, now we are done assessing the anterior thorax and the posterior thorax. Okay, so hello Gerald. So the assessment is done. So for today, I am going to summarize everything that we have obtained to the assessment earlier. So everything I observed is normal, but there is slightly curvature at your cervical when every time you sit. So as I noticed, meron po kayong parang curve sa likod nyo kapag uupo kayo, okay? So, when I inspect both anterior and posterior, so there is no tenderness and there is no bulges. So, when I palpate your chest and at your back, so that time, when I'm touching your chest, so there is no abnormalities. So, when I did percussing, so when I percuss every spaces here, when yung ginapitik ko po, as you notice, so I noticed that it has resonance. So when I auscultate, so using my stethoscope, both anterior and posterior, so there is no abnormalities or there is no abnormal sounds. So everything is normal. So we will be referring to you a doctor so that he will check you furthermore, so about your curvature. And I am advising you to eat healthy foods, drink more milk, and drink or eat some foods that high in calcium so that mas maging strong yung bone natin, especially your spinal bone. And also, I am advising you to stay away from the people who are smoking. So as you have said, right, that your father and your brother are smoking. So I am advising you to stay away so that you cannot inhale the smoke of the cigarettes so that it will not affect your lungs. So anything else is that that's all. So the only thing I want to tell you is that stay hydrated, drink more water, and eat some healthy foods, okay?
Okay.
So do you have any questions or any clarifications about the assessment that we're doing earlier?
No.
Nothing? Okay. So thank you, Gerald, for your cooperation. So that's all. Thank you.
Thank you, Buwan.